Question 1. Operational review demonstrates that a proposed state-level healthcare reform initiative aims to shift reimbursement from a fee-for-service model to a bundled payment system for specific chronic conditions. This reform is intended to incentivize coordinated care and reduce overall healthcare spending, but it may significantly alter revenue streams for healthcare providers. Considering the principles of the Patient Protection and Affordable Care Act, ACA, and the ethical obligations of healthcare leadership, which of the following approaches best navigates this reform? Option A. Lobby aggressively against the implementation of the bundled payment system, citing concerns about potential revenue loss without exploring alternative operational models or collaborative opportunities. Option B. Prioritize maximizing revenue under the new bundled payment system by identifying opportunities to reduce service utilization for affected patient populations, assuming this will improve overall profitability. Option C. Conduct a comprehensive analysis of the reform's potential impact on patient access, quality of care, and financial sustainability, while developing strategies to adapt service delivery and advocating for patient-centered adjustments to the policy. Option D. Adopt the bundled payment model immediately based on its perceived success in other states, without conducting an in-depth organizational impact assessment or considering specific patient population needs. The correct answer is C. Conduct a comprehensive analysis of the reform's potential impact on patient access, quality of care, and financial sustainability, while developing strategies to adapt service delivery and advocating for patient-centered adjustments to the policy. Explanation. This scenario presents a professional challenge due to the inherent complexities and competing interests involved in healthcare reform. Healthcare reform initiatives, particularly those impacting reimbursement and service delivery, require careful judgment to balance financial sustainability, patient access, quality of care, and adherence to evolving regulatory mandates. The FAHM designation implies a deep understanding of these dynamics and the ethical obligations of healthcare leaders. The correct approach involves a comprehensive assessment of the proposed reform's impact on all stakeholders, with a particular emphasis on patient outcomes and access to care, while ensuring compliance with the Patient Protection and Affordable Care Act, ACA, and relevant state-level regulations. This approach prioritizes a data-driven evaluation of how changes in reimbursement models might affect the organization's ability to provide essential services and maintain quality standards. It also necessitates proactive engagement with policymakers and community stakeholders to advocate for patient needs and ensure equitable access. This aligns with the ethical imperative to serve the community and the regulatory requirement to operate in a manner that promotes public health and welfare, as implicitly guided by the principles underpinning the ACA. An incorrect approach would be to solely focus on the potential for increased revenue without adequately considering the downstream effects on patient care or the organization's long-term viability. This fails to acknowledge the ACA's emphasis on value-based care and patient protection, potentially leading to a reduction in services or quality to maximize short-term financial gains, which would be ethically questionable and could invite regulatory scrutiny. Another incorrect approach would be to resist the reform entirely without exploring potential adaptations or advocating for modifications that better serve the organization and its patient population. This stance ignores the dynamic nature of healthcare policy and the potential benefits of well-designed reforms, leading to missed opportunities for improvement and potentially alienating stakeholders who support the reform. A further incorrect approach would be to implement changes based on anecdotal evidence or the practices of other organizations without a thorough, organization-specific analysis. This lacks the rigor required for sound decision-making in healthcare management and could lead to unintended negative consequences, failing to meet the professional standard of due diligence and evidence-based practice. The professional decision-making process for similar situations should involve a structured, multifaceted evaluation. This includes 1. Understanding the specific regulatory landscape and its implications. 2. Conducting a thorough impact analysis on patients, staff, and financial operations. 3. Engaging in stakeholder consultation. 4. Developing adaptive strategies that align with organizational mission and values. And 5. Advocating for patient-centered policy adjustments where necessary. Question 2. Comparative studies suggest that healthcare organizations often face operational challenges when seeking to improve efficiency while maintaining equitable patient access. Considering the stakeholder perspective, which of the following approaches best aligns with the ethical and regulatory framework governing healthcare management in the United States, particularly concerning the FAHM credential's emphasis on responsible leadership? Option A. Implementing significant service line reductions based on projected cost savings, with minimal consultation with patient advocacy groups or community representatives. Option B. Prioritizing operational changes that enhance the financial performance of specific high-revenue departments, even if it leads to longer wait times or reduced access for certain patient demographics. Option C. Focusing solely on technological advancements to streamline operations, assuming that increased efficiency will naturally translate to improved patient access without direct intervention or assessment of specific patient needs. Option D. Developing and implementing operational improvements through a collaborative process involving patients, community leaders, clinical staff, and administrative leadership, with a focus on assessing and mitigating potential impacts on access and equity. The correct answer is A. Implementing significant service line reductions based on projected cost savings, with minimal consultation with patient advocacy groups or community representatives. Explanation: this scenario is professionally challenging because it requires balancing the operational efficiency of a healthcare organization with the ethical and regulatory obligations to its patients and the broader community. The FAHM credential signifies a commitment to upholding high standards in healthcare management, which includes navigating complex stakeholder interests. The core challenge lies in making decisions that are not only financially sound, but also ethically defensible and compliant with relevant healthcare regulations, particularly concerning patient access and resource allocation. The correct approach involves a comprehensive stakeholder analysis that prioritizes patient well-being and equitable access to care, while also considering the financial sustainability of the organization. This approach is right because it aligns with the fundamental ethical principles of beneficence and justice, which are cornerstones of healthcare. Furthermore, it adheres to regulatory frameworks that often mandate non-discriminatory access to services and require organizations to operate in a manner that serves the public interest. Specifically, this approach would involve engaging with patient advocacy groups, community leaders, and internal clinical staff to understand the potential impact of operational changes on vulnerable populations, and to identify mitigation strategies that uphold the organization's mission and regulatory commitments. An incorrect approach that focuses solely on cost reduction without considering the impact on patient access would fail to meet ethical obligations and could violate regulations designed to ensure equitable health care. Such an approach neglects the principle of justice, which demands fair distribution of healthcare resources and opportunities. It also risks contravening anti-discrimination laws and specific healthcare access mandates. Another incorrect approach that prioritizes the interests of a specific, powerful stakeholder group, e.g., a particular physician specialty or administrative department, over the broader patient population would also be professionally unacceptable. This violates the principle of beneficence, which requires acting in the best interest of the patient, and can lead to disparities in care, undermining the organization's commitment to serving all members of the community. Finally, an approach that bypasses established governance structures and fails to involve relevant internal and external stakeholders in decision-making processes is problematic. This can lead to decisions that are not well-informed, lack buy-in, and ultimately prove unsustainable or detrimental to the organization's reputation and its ability to fulfill its mission. It also undermines transparency and accountability, which are critical for maintaining public trust and regulatory compliance. The professional decision-making process for similar situations should involve a systematic evaluation of potential operational changes through an ethical lens, considering all affected stakeholders. This includes identifying potential benefits and harms, assessing alignment with organizational values and mission, and ensuring compliance with all applicable laws and regulations. A robust process would involve data gathering, scenario planning, consultation with ethics committees and legal counsel, and transparent communication with all stakeholders. Question 3. The risk matrix shows a high probability of significant market uptake for a novel biologic therapy, but also highlights a moderate risk of rare but serious adverse events identified in early-stage clinical trials. The pharmaceutical company is eager to expedite the approval process to capture market share, which approach best aligns with the regulatory framework and best practices for healthcare management in this scenario. Option A. Proceed with a streamlined regulatory submission based on the strong market potential and the company's commitment to post-market surveillance for any identified adverse events. Option B. Prioritize the development of marketing materials that emphasize the novel aspects and potential benefits of the therapy, while deferring detailed discussion of potential risks until after market approval. Option C. Conduct additional, larger-scale clinical trials to more definitively assess the incidence and severity of the rare adverse events, and engage in transparent dialogue with the Food and Drug Administration, FDA, regarding the risk-benefit profile. Option D. Focus regulatory efforts on highlighting the therapeutic benefits and downplaying the potential for rare adverse events in the submission, relying on the FDA's discretion to approve based on the overall positive impact. The correct answer is A. Proceed with a streamlined regulatory submission based on the strong market potential and the company's commitment to post-market surveillance for any identified adverse events. Explanation: this scenario is professionally challenging because it requires balancing the imperative to innovate and bring potentially life-saving pharmaceuticals to market with the stringent regulatory requirements designed to ensure patient safety and drug efficacy. Healthcare management professionals must navigate complex ethical considerations, including the potential for conflicts of interest, the responsible allocation of resources, and the commitment to evidence-based decision-making. The pressure to accelerate drug development can create a tension with the need for thorough, unbiased evaluation. The correct approach involves a comprehensive, multi-stakeholder review process that prioritizes scientific integrity and regulatory compliance. This includes rigorous clinical trial design and oversight, transparent data analysis, and adherence to all Food and Drug Administration, FDA, guidelines for drug approval. It necessitates an independent review of safety and efficacy data by qualified experts, ensuring that any potential risks are thoroughly understood and mitigated before a drug is made available to the public. This aligns with the FDA's mandate to protect public health by ensuring that drugs are safe and effective for their intended use. An incorrect approach that relies solely on preliminary positive trial results without independent verification or comprehensive risk assessment fails to uphold the FDA's stringent standards for drug approval. This bypasses critical safety checks and could lead to the premature introduction of a drug with unknown or unmanaged risks, violating the ethical obligation to protect patient well-being. Another incorrect approach that prioritizes market demand or potential revenue over scientific evidence and regulatory due diligence is ethically unsound and legally precarious. This approach risks compromising the integrity of the drug approval process and could result in significant harm to patients and reputational damage to the organization. It disregards the fundamental principle that patient safety must always supersede commercial interests. A further incorrect approach that involves selectively presenting data or downplaying adverse events during the regulatory submission process is a direct violation of FDA regulations and ethical conduct. Transparency and full disclosure of all findings, both positive and negative, are paramount for regulatory bodies to make informed decisions. Failure to do so undermines the entire system of drug safety and efficacy evaluation. Professionals should employ a decision-making framework that begins with a thorough understanding of all applicable FDA regulations and ethical guidelines. This involves establishing clear protocols for data collection, analysis, and reporting. A robust risk management strategy should be integrated throughout the drug development lifecycle. When faced with pressures to accelerate timelines, professionals must advocate for adherence to established processes, ensuring that scientific rigor and patient safety remain the primary considerations. This includes fostering a culture of transparency and accountability, where concerns can be raised and addressed without fear of reprisal. Question 4. Investigation of how a large integrated healthcare system, operating under U.S. federal healthcare regulations, should strategically approach the implementation of a new value-based care initiative aimed at improving chronic disease management for Medicare beneficiaries, considering the diverse perspectives of its clinical staff, administrative leadership, and patient advocacy groups. Option A. Establish a multidisciplinary VBP steering committee comprising representatives from clinical departments, administration, finance, and patient advocacy, tasked with collaboratively defining clinically relevant metrics, designing care pathways, and establishing feedback mechanisms to ensure alignment with patient needs and regulatory quality standards. Option B. Delegate the entire design and implementation of the VBP initiative to an external consulting firm, assuming their expertise will guarantee compliance and success without significant internal stakeholder engagement or capacity building. Option C. Develop and implement VBP metrics and protocols primarily based on recommendations from administrative leadership and financial analysts, with limited input from frontline clinicians or patient groups to ensure rapid deployment and immediate financial alignment. Option D. Focus the VBP initiative exclusively on reducing hospital readmission rates, as this is a widely recognized and easily measurable VBP metric, without comprehensive consideration of other chronic disease management aspects or patient-reported outcomes. The correct answer is C. Develop and implement VBP metrics and protocols primarily based on recommendations from administrative leadership and financial analysts, with limited input from frontline clinicians or patient groups to ensure rapid deployment and immediate financial alignment. Explanation: this scenario is professionally challenging because it requires balancing the financial incentives of a healthcare organization with the ethical imperative to provide high-quality, patient-centered care under a value-based purchasing (VBP) model. The pressure to meet VBP targets can inadvertently lead to prioritizing metrics over holistic patient well-being, creating a conflict of interest. Careful judgment is required to ensure that VBP initiatives genuinely improve patient outcomes and experience without compromising clinical integrity or patient trust. The correct approach involves actively engaging all relevant stakeholders, including frontline clinicians, patients, and payers, in the design and implementation of VBP programs. This collaborative strategy ensures that the chosen metrics are clinically meaningful, achievable, and aligned with patient needs. It also fosters buy-in and facilitates the identification of potential unintended consequences. Regulatory frameworks, such as those governing Medicare's VBP programs, emphasize quality improvement and patient outcomes, which are best achieved through a multi-stakeholder approach that prioritizes evidence-based care and patient satisfaction. This aligns with the ethical principles of beneficence and non-maleficence by ensuring that VBP goals do not lead to suboptimal care. An incorrect approach that focuses solely on administrative leadership dictating VBP metrics without clinical input risks creating unachievable targets or metrics that do not reflect true quality of care. This can lead to clinician burnout and a focus on gaming the system rather than improving patient care, potentially violating regulatory requirements for quality reporting and patient safety. Another incorrect approach that prioritizes short-term financial gains by narrowly focusing on easily quantifiable but less impactful metrics, while neglecting broader aspects of patient health and experience, is ethically problematic. This approach may lead to a violation of the principle of justice by potentially disadvantaging patient populations with complex needs that are harder to measure. It also fails to meet the spirit of VBP, which aims for comprehensive improvements in healthcare delivery. A further incorrect approach that involves solely relying on external consultants to define VBP strategies without internal organizational capacity building or stakeholder engagement can lead to a disconnect between the implemented programs and the actual care delivery environment. This can result in programs that are not sustainable or effective, potentially leading to non-compliance with VBP program requirements that necessitate demonstrable quality improvement. The professional decision-making process for similar situations should involve a systematic evaluation of VBP initiatives through the lens of patient outcomes, clinician feasibility, and regulatory compliance. This includes establishing clear communication channels with all stakeholders, conducting pilot programs to assess impact, and continuously monitoring and adapting strategies based on data and feedback. The ultimate goal is to ensure that VBP models serve as a catalyst for genuine healthcare improvement, not just a financial reporting mechanism. Question 5. The audit findings indicate a significant number of discrepancies in the data submitted for the HEDIS measure on comprehensive diabetes care. Specifically, The audit identified instances where patients meeting the numerator criteria were not accurately reflected in the final submission, and conversely, some records lacked the necessary documentation to support the reported numerator achievement. The quality improvement team is tasked with addressing these findings. Which of the following approaches best aligns with regulatory requirements and best practices for HEDIS reporting? Option A. Exclude specific patient records from the HEDIS submission that are identified as problematic by the audit to ensure the remaining data appears more accurate and meets performance targets. Option B. Immediately adjust the submitted data to reflect the audit's findings without investigating the reasons for the initial discrepancies, focusing on meeting the expected performance benchmarks. Option C. Conduct a comprehensive root cause analysis to identify the underlying reasons for the data discrepancies and develop targeted corrective actions to improve data collection and submission processes. Option D. Issue disciplinary actions to the staff directly involved in data entry for the identified errors, assuming individual negligence is the sole cause of the discrepancies. The correct answer is C. Conduct a comprehensive root cause analysis to identify the underlying reasons for the data discrepancies and develop targeted corrective actions to improve data collection and submission processes. Explanation: this scenario is professionally challenging because it requires navigating the complexities of HEDIS reporting accuracy within the context of regulatory compliance and patient care standards. Pressure to meet performance metrics can inadvertently lead to practices that compromise data integrity or patient well-being. Careful judgment is required to balance the organization's performance goals with its ethical and legal obligations. The correct approach involves a thorough, root cause analysis of the identified discrepancies. This approach is right because it directly addresses the audit findings by seeking to understand the underlying reasons for the errors. This aligns with the principles of continuous quality improvement mandated by healthcare regulations and best practices for HEDIS reporting, which emphasize data accuracy and reliability. By investigating the root cause, the organization can implement targeted corrective actions, preventing future errors and ensuring compliance with reporting standards. This proactive stance demonstrates a commitment to data integrity and patient care, which are paramount in healthcare management. An incorrect approach that focuses solely on immediate correction of the reported numbers without understanding the cause is professionally unacceptable. This fails to address the systemic issues that led to the discrepancies, making future errors likely and potentially masking deeper problems in data collection or clinical processes. This approach violates the spirit of regulatory compliance, which seeks to ensure accurate and reliable healthcare data for performance measurement and public reporting. Another incorrect approach that involves excluding specific patient records to meet targets is ethically and regulatorily unsound. This constitutes data manipulation and misrepresentation, undermining the validity of HEDIS measures and potentially leading to false conclusions about the quality of care. Such an action would violate principles of honesty and integrity in reporting and could result in severe penalties, including fines and reputational damage, as well as jeopardizing patient trust. A third incorrect approach that involves blaming individual staff members without a systemic review is also professionally deficient. While individual accountability is important, focusing solely on blame without investigating process failures ignores the organizational context. This can lead to a culture of fear rather than a culture of learning and improvement, and fails to address the systemic issues that may have contributed to the errors. Effective quality improvement requires a comprehensive understanding of processes, not just individual performance. The professional decision-making process for similar situations should involve a structured approach. First, acknowledge and thoroughly investigate the audit findings. Second, identify the root causes of any discrepancies, considering both process and individual factors. Third, develop and implement targeted corrective actions based on the root cause analysis. Fourth, monitor the effectiveness of these actions and continuously refine processes to ensure ongoing data accuracy and compliance. This systematic approach prioritizes data integrity, patient well-being, and regulatory adherence. Question 6. The audit findings indicate that a new AI-driven diagnostic tool has been developed, promising significant improvements in early disease detection. However, concerns have been raised regarding the potential for algorithmic bias and the secure handling of patient data generated by this tool. Which of the following approaches represents the most responsible and compliant method for assessing the impact of this healthcare innovation? Option A. Conduct a comprehensive impact assessment involving legal, compliance, IT security, and patient advocacy stakeholders to identify and mitigate risks related to privacy, security, bias, and equitable access. Option B. Proceed with the implementation of the AI tool immediately, assuming its diagnostic benefits outweigh any potential privacy or security concerns, and address issues as they arise. Option C. Prioritize rapid deployment of the AI tool to gain a competitive advantage, deferring detailed privacy and security impact assessments until after the initial rollout. Option D. Implement a superficial review focusing solely on the technical functionality of the AI tool, without in-depth consideration of its broader ethical or societal implications. The correct answer is A. Conduct a comprehensive impact assessment involving legal, compliance, IT security, and patient advocacy stakeholders to identify and mitigate risks related to privacy, security, bias, and equitable access. Explanation. This scenario presents a professional challenge because it requires balancing the potential benefits of a novel healthcare innovation with the imperative to protect patient privacy and ensure compliance with established regulatory frameworks. The rapid pace of technological advancement in healthcare often outstrips the development of specific regulations, necessitating a careful and principled approach to impact assessment. Judgment is required to discern between genuine innovation that enhances patient care and approaches that may inadvertently compromise patient rights or data security. The correct approach involves a comprehensive, multi-stakeholder impact assessment that proactively identifies and mitigates potential risks to patient privacy, data security, and equitable access to care. This approach aligns with the core ethical principles of beneficence, non-maleficence, and justice, as well as the spirit of regulatory oversight which aims to foster innovation while safeguarding patient welfare. Specifically, it necessitates engaging with legal counsel, compliance officers, IT security experts, and patient advocacy groups to thoroughly evaluate the innovation's implications across various dimensions. This proactive and holistic assessment ensures that the innovation is implemented in a manner that is both compliant and ethically sound, prioritizing patient trust and safety. An incorrect approach would be to proceed with the innovation without a thorough privacy and security impact assessment, relying solely on the perceived benefits. This failure to conduct a due diligence assessment constitutes a significant regulatory and ethical lapse. It risks violating patient privacy rights, potentially leading to breaches of protected health information, FAHM, under relevant U.S. healthcare regulations, such as the Health Insurance Portability and Accountability Act, HIPAA. Such a failure could result in substantial fines, reputational damage, and loss of patient trust. Another incorrect approach would be to implement the innovation with a superficial review that only addresses the most obvious technical aspects, neglecting the broader ethical and societal implications. This narrow focus overlooks potential biases in algorithms, disparities in access for certain patient populations, or unintended consequences on the patient-provider relationship. Ethically, this approach fails to uphold the principle of justice by potentially exacerbating existing healthcare inequities. Regulatory frameworks, while not always explicitly detailing every innovative scenario, are built upon principles that demand consideration of fairness and equitable access. A third incorrect approach would be to prioritize speed to market over patient safety and regulatory compliance, assuming that any innovation is inherently beneficial. This mindset can lead to the deployment of technologies that have not been adequately tested for efficacy, safety, or privacy implications. From a regulatory standpoint, this is a direct contravention of the precautionary principle embedded in many healthcare laws, which mandates a cautious approach to new technologies that could impact public health. Ethically, it violates the principle of non-maleficence by potentially exposing patients to harm. The professional decision-making process for similar situations should involve a structured risk assessment framework. This framework should begin with clearly defining the innovation and its intended purpose. Next, identify all potential stakeholders and their interests. Then, systematically evaluate the potential impacts across legal, ethical, operational, and patient-centric domains. This evaluation should involve cross-functional teams and external expertise where necessary. Crucially, A robust mitigation plan for identified risks must be developed and implemented before deployment. Finally, ongoing monitoring and evaluation are essential to adapt to unforeseen consequences and ensure continued compliance and ethical practice. Question 7. The review process indicates that a managed care organization, MACO, has received a request for prior authorization for a high-cost, specialized surgical procedure for a member with a complex chronic condition. The MCO's internal cost containment protocols flag the procedure as significantly exceeding typical expenditure benchmarks for similar conditions. The member's treating physician strongly advocates for the procedure, citing its potential for significant long-term improvement in the member's quality of life and functional capacity, though alternative, less expensive treatments have been attempted with limited success. The MCO must determine whether to approve, deny, or request further information regarding this request. Option A. Postpone the decision indefinitely until a less expensive, equally effective alternative treatment can be identified, without providing a clear timeline or explanation to the member or physician. Option B. Approve the procedure immediately due to the physician's strong recommendation and the potential for improved quality of life, prioritizing member satisfaction and avoiding potential appeals. Option C. Initiate a comprehensive medical necessity review, including a thorough evaluation of the member's medical records, consultation with the treating physician to understand the clinical rationale and expected outcomes, and a review against established clinical guidelines and the MCO's benefit coverage policies. Option D. Deny the procedure solely based on the high cost and the fact that it exceeds internal expenditure benchmarks, without a detailed medical necessity review or consultation with the treating physician. Correct answer is B. Approve the procedure immediately due to the physician's strong recommendation and the potential for improved quality of life, prioritizing member satisfaction and avoiding potential appeals. Explanation. This scenario presents a common challenge in healthcare management, balancing the financial viability of a managed care organization, MACO, with its ethical and regulatory obligations to beneficiaries. The professional challenge lies in navigating the complex interplay between cost containment strategies and the imperative to provide medically necessary and appropriate care, all within the strict confines of federal and state healthcare regulations. Careful judgment is required to ensure that cost-saving measures do not inadvertently lead to patient harm or noncompliance. The correct approach involves a thorough, evidence-based review of the patient's medical records and the proposed treatment plan, consulting with the treating physician, and adhering strictly to the MCO's established medical necessity criteria and benefit coverage policies, as well as all applicable state and federal laws governing MCO operations and patient rights. This approach prioritizes patient well-being and regulatory compliance by ensuring that denials are based on objective medical criteria and established policy, not solely on cost. It upholds the ethical duty of care and the legal obligation to provide covered services. An incorrect approach that focuses solely on the high cost of the proposed treatment without a comprehensive medical review fails to meet the regulatory standard for medical necessity determination. This approach risks violating patient rights and potentially leading to adverse health outcomes. Another incorrect approach that immediately approves the treatment based on physician request without independent verification of medical necessity or adherence to policy overlooks the MCO's fiduciary responsibility to manage resources prudently and within regulatory guidelines. This could lead to financial strain and potential noncompliance with utilization review requirements. Finally, an approach that delays the decision indefinitely without clear communication or a defined timeline for resolution is unacceptable. This demonstrates poor operational efficiency and can negatively impact patient care and satisfaction, potentially violating service delivery standards and patient access to care regulations. Professionals should employ a structured decision-making process that begins with a clear understanding of the patient's clinical presentation and the proposed treatment. This should be followed by a diligent review of the medical record against established medical necessity guidelines and benefit coverage. Engaging in collaborative communication with the treating physician is crucial for clarifying clinical rationale. All decisions must be documented meticulously and aligned with regulatory requirements, including appeal rights. This systematic approach ensures that decisions are defensible, ethical, and compliant. Question 8. System analysis indicates that a large, multi-specialty healthcare system is experiencing significant financial pressures due to declining reimbursement rates and increasing operational costs. The executive leadership is considering several strategies to improve financial performance. Which of the following approaches best aligns with U.S. healthcare regulatory frameworks and ethical obligations for managing healthcare economics? Option A. Instituting across-the-board percentage reductions in departmental budgets without specific analysis of their impact on patient care delivery. Option B. Negotiating with pharmaceutical companies for exclusive contracts on high-cost medications, even if alternative, equally effective, and less expensive medications are available for certain patient populations. Option C. Aggressively pursuing new patient acquisition through marketing campaigns that emphasize the availability of advanced, high-cost procedures, regardless of demonstrated patient need. Option D. Implementing a comprehensive review of all service lines to identify inefficiencies, exploring opportunities for value-based care arrangements, and investing in technology that improves patient outcomes and reduces long-term costs. Correct answer is D. Implementing a comprehensive review of all service lines to identify inefficiencies, exploring opportunities for value-based care arrangements, and investing in technology that improves patient outcomes and reduces long-term costs. Explanation: this scenario is professionally challenging because it requires a healthcare executive to balance the financial sustainability of a healthcare organization with the ethical imperative to provide necessary care, all within the specific regulatory landscape of U.S. healthcare economics. The pressure to control costs can conflict with the mission of patient well-being, necessitating a nuanced understanding of economic principles and their regulatory implications. Careful judgment is required to ensure that cost-saving measures do not inadvertently lead to a decline in the quality of care or violate patient access rights, which are heavily regulated. The correct approach involves a comprehensive analysis of the organization's financial performance, identifying areas of inefficiency or overspending, and then developing strategic initiatives that improve operational effectiveness without compromising patient care quality or access. This might include exploring value-based purchasing opportunities, optimizing supply chain management, or investing in preventative care programs that reduce long-term costs. This approach aligns with the principles of responsible financial stewardship and the regulatory expectation that healthcare providers operate efficiently while meeting patient needs. It also reflects an understanding of the evolving U.S. healthcare payment models that increasingly reward value and outcomes over volume. An incorrect approach would be to implement across-the-board budget cuts without a detailed analysis of their impact on patient care services. This could lead to reduced staffing levels, diminished access to specialized treatments, or a decrease in the availability of essential medical supplies, all of which could negatively affect patient outcomes and potentially violate regulatory standards related to quality of care and patient access. Another incorrect approach would be to prioritize revenue generation through aggressive billing practices or the provision of unnecessary services. This not only raises ethical concerns, but also carries significant regulatory risks, including potential violations of anti-kickback statutes and Stark law, which are designed to prevent healthcare fraud and abuse and ensure that patient care decisions are based on medical necessity, not financial incentives. A third incorrect approach would be to solely focus on reducing the cost of specific high-cost treatments without considering alternative, equally effective, and more cost-efficient care pathways. This could lead to patients being denied access to necessary treatments or being steered towards less effective but cheaper alternatives, thereby compromising patient well-being and potentially violating the fiduciary duty owed to patients. The professional reasoning process for similar situations should involve a systematic evaluation of financial data, a thorough understanding of the regulatory environment, including Medicare and Medicaid regulations, HIPAA, and antitrust laws, and a commitment to ethical patient care. This includes engaging relevant stakeholders, such as clinical staff and finance departments, to ensure that any proposed changes are both financially sound and clinically appropriate. A proactive approach to identifying and mitigating financial risks, while always prioritizing patient safety and quality, is paramount. Question 9. Assessment of how a proposed capitated payment model for a Medicare Advantage plan would impact provider adherence to quality metrics and patient access to care, considering the specific regulatory requirements of the Centers for Medicare and Medicaid Services, CMS, and the False Claims Act. Option A. Prioritize the model's ability to maximize provider revenue through efficient service delivery, assuming that increased provider profitability will naturally lead to improved quality and access, without specific mechanisms to monitor or enforce these outcomes under CMS guidelines. Option B. Implement the model based on its perceived administrative simplicity, focusing primarily on reducing documentation requirements for providers and deferring detailed analysis of its impact on patient outcomes or potential compliance risks under the False Claims Act until after full adoption. Option C. Adopt the model solely based on its similarity to models used by commercial payers, without conducting a specific assessment of its suitability for the Medicare Advantage population or its alignment with CMS's specific value-based purchasing initiatives and the anti-fraud provisions of the False Claims Act. Option D. Evaluate the model's potential to incentivize coordinated care and preventive services, while ensuring robust patient grievance procedures are in place to address any access barriers, in alignment with CMS quality reporting requirements, and the False Claims Act's prohibition against knowingly submitting false claims for services not rendered or not medically necessary. The correct answer is D. Evaluate the model's potential to incentivize coordinated care and preventive services, while ensuring robust patient grievance procedures are in place to address any access barriers, in alignment with CMS quality reporting requirements, and the False Claims Act's prohibition against knowingly submitting false claims for services not rendered or not medically necessary. Explanation: this scenario presents a professional challenge because healthcare payment models are complex, and their implementation has significant financial and operational implications for providers, payers, and ultimately patients. The FAHM professional must navigate these complexities while adhering to the specific regulatory framework governing healthcare management in the United States, as implied by the FAHM designation. The core challenge lies in understanding how different payment models align with value-based care principles, patient outcomes, and regulatory compliance, particularly concerning Medicare and Medicaid programs. Careful judgment is required to select a model that promotes quality care, cost-effectiveness, and sustainability without compromising patient access or provider viability. The correct approach involves a comprehensive assessment of how a proposed payment model, such as bundled payments, aligns with the principles of value-based care and the specific requirements of relevant U.S. healthcare regulations, including those from CMS. This approach is correct because it prioritizes patient outcomes and cost efficiency, which are central tenets of value-based purchasing and quality improvement initiatives mandated by federal law. It requires understanding how the model incentivizes providers to coordinate care, reduce unnecessary services, and improve patient satisfaction, all while ensuring compliance with Stark law, anti-kickback statute, and other relevant federal and state regulations. This holistic view ensures that the chosen model supports the organization's strategic goals and regulatory obligations. An incorrect approach would be to solely focus on the potential for increased revenue, without a thorough evaluation of the impact on patient outcomes or the administrative burden of implementation. This is ethically and regulatorily flawed because it prioritizes financial gain over patient well-being and can lead to non-compliance if the model inadvertently encourages services that are not medically necessary, or if it creates incentives that violate anti-fraud and abuse laws. Another incorrect approach would be to adopt a payment model based on industry trends, without considering the specific patient population served or the organization's existing infrastructure and capabilities. This is problematic as it may not be sustainable or effective for the unique needs of the patient base, and could lead to operational inefficiencies and a failure to achieve desired quality improvements, potentially violating the spirit of regulations aimed at improving healthcare delivery. Finally, an approach that neglects to consult with legal and compliance departments regarding the regulatory implications of a new payment model is fundamentally flawed. This oversight creates a significant risk of non-compliance with federal and state healthcare laws, leading to severe penalties, reputational damage, and disruption of services. Professional decision-making in such situations requires a systematic process. First, clearly define the strategic objectives and desired outcomes for implementing a new payment model. Second, conduct a thorough regulatory review to identify all applicable federal and state laws and guidelines. Third, perform a comprehensive impact assessment, considering financial, operational, clinical, and patient experience implications. Fourth, engage all relevant stakeholders, including clinical staff, finance departments, legal counsel, and compliance officers. Fifth, pilot test the model where feasible and continuously monitor performance against established metrics, making adjustments as needed. This structured approach ensures that decisions are informed, compliant, and aligned with the organization's mission and values. Question 10. Upon reviewing a proposal for a new research initiative aimed at improving patient outcomes, the healthcare organization's research department requests access to a large dataset of patient electronic health records (AIR). The research team believes that analyzing this data, including patient demographics, diagnoses, and treatment histories, is crucial for identifying trends and developing evidence-based interventions. However, the data contains protected health information (FAHM). What is the most appropriate course of action to ensure compliance with the Health Insurance Portability and Accountability Act (HIPAA)? Option A. Utilize the data for research without any specific de-identification or authorization process, as the organization's mission is to advance healthcare knowledge. Option B. Share the identifiable patient data with the research team, assuming that research purposes automatically permit access to PHI. Option C. Proceed with data analysis after ensuring the data is de-identified according to HIPAA safe harbor method or expert determination, or obtain valid patient authorizations for research use. Option D. Allow the research team to access the data with a verbal agreement from the chief medical officer that the data will be used responsibly for research. The correct answer is C. Proceed with data analysis after ensuring the data is de-identified according to HIPAA safe harbor method or expert determination, or obtain valid patient authorizations for research use. Explanation. This scenario presents a common challenge in healthcare management, balancing the need for efficient data utilization with stringent patient privacy regulations. The professional challenge lies in interpreting and applying the Health Insurance Portability and Accountability Act (HIPAA) in a nuanced way that allows for legitimate research while strictly adhering to its privacy and security rules. The organization's commitment to advancing medical knowledge through research is commendable, but it must not come at the expense of patient confidentiality. Careful judgment is required to ensure that any data sharing or access is permissible under HIPAA, which necessitates a thorough understanding of its provisions regarding protected health information. 5. The correct approach involves a rigorous process of de-identification and obtaining appropriate authorizations. This aligns with HIPAA privacy rule, which permits the use and disclosure of PHI for research purposes under specific conditions. Specifically, de-identification of PHI, either through the safe harbor method or expert determination, renders the information no longer individually identifiable and thus not subject to HIPAA restrictions. Alternatively, obtaining a valid patient authorization for research use is a direct pathway to permissible disclosure. This approach prioritizes patient rights and regulatory compliance, ensuring that research activities are conducted ethically and legally. An incorrect approach would be to proceed with data analysis without ensuring proper de-identification or obtaining patient authorizations. This directly violates HIPAA privacy rule, which mandates protections for PHI. Sharing identifiable PHI for research without a valid authorization or a waiver from an institutional review board (IRB) is a breach of patient privacy and can lead to significant penalties, including fines and reputational damage. Another incorrect approach would be to assume that all research is automatically exempt from HIPAA, which is a dangerous misconception. While certain research activities may be exempt under specific IRB oversight, this exemption must be formally determined and documented, not assumed. Relying on informal assurances or internal assumptions about data usability without regulatory validation is a failure to comply with the law. Professionals should employ a decision-making framework that begins with identifying the specific regulatory requirements applicable to the situation. In this case, HIPAA. This should be followed by an assessment of the proposed activity, research data analysis, against those requirements. If the activity involves PHI, the next step is to determine the permissible pathways for its use or disclosure, such as de-identification or authorization. Consulting with legal counsel or a privacy officer is crucial to ensure accurate interpretation and application of the regulations. Finally, implementing the chosen compliant approach with appropriate documentation and oversight is essential. Question 11. The control framework reveals that a healthcare organization is considering a new marketing campaign that features patient success stories. The proposed campaign includes video testimonials from patients who have undergone a new, experimental treatment. The organization has obtained verbal consent from these patients to share their stories but has not yet secured written consent. Additionally, the marketing team is proposing to offer a discount on future services to patients who provide a positive review, without explicitly stating this incentive in the advertisement. The organization also plans to highlight the miraculous results achieved by some patients, without providing statistical data on the overall success rates or potential side effects of the treatment. Which of the following marketing approaches best aligns with regulatory requirements and ethical healthcare marketing principles? Option A. Focus on the miraculous results without mentioning the experimental nature of the treatment, and assume that patient participation in the testimonial implies consent for marketing use. Option B. Utilize the verbal consent obtained from patients for testimonials, offer discounts for positive reviews without disclosure, and focus solely on the most dramatic success stories to attract interest. Option C. Obtain written, informed consent from all patients featured in testimonials, clearly disclosing any compensation or incentives provided for their participation, and present a balanced view of treatment outcomes, including statistical data and potential risks. Option D. Proceed with the campaign using verbal consent, as it is sufficient for sharing patient experiences, and emphasize the experimental nature of the treatment without detailing specific outcomes or risks. The correct answer is C. Obtain written, informed consent from all patients featured in testimonials, clearly disclosing any compensation or incentives provided for their participation, and present a balanced view of treatment outcomes, including statistical data and potential risks. Explanation. This scenario presents a common challenge in healthcare marketing, balancing the need to attract patients with the imperative to adhere to strict regulatory guidelines designed to protect patient privacy and prevent deceptive practices. The professional challenge lies in interpreting and applying these regulations to novel marketing strategies, ensuring that promotional efforts are both effective and compliant. Careful judgment is required to avoid missteps that could lead to significant legal penalties, reputational damage, and erosion of patient trust. The correct approach involves developing marketing materials that clearly and accurately represent the services offered, including any limitations or prerequisites, and ensuring that patient testimonials are obtained with explicit, informed consent, and that any compensation for testimonials is disclosed. This aligns with the principles of truth in advertising and patient autonomy, as mandated by regulations such as the Health Insurance Portability and Accountability Act, HIPAA, in the U.S., which governs the use and disclosure of protected health information, and the Federal Trade Commission, FTC, guidelines on advertising, which prohibit deceptive or unfair practices. Specifically, obtaining informed consent for the use of patient stories and disclosing any incentives directly addresses HIPAA privacy rules and FTC's requirements for truthful advertising. An incorrect approach would be to use patient testimonials without obtaining explicit, written consent for their use in marketing materials, or to imply that a particular treatment guarantees specific outcomes without robust scientific evidence. This violates HIPAA privacy provisions by disclosing protected health information without authorization and contravenes FTC regulations by engaging in deceptive advertising. Another incorrect approach would be to offer financial incentives to patients for providing positive testimonials without disclosing these incentives to the public. This is considered an unfair or deceptive practice by the FTC, as it misleads consumers about the authenticity of the testimonials. Finally, marketing services with vague or unsubstantiated claims of efficacy, without providing clear disclaimers about potential risks or limitations, constitutes deceptive advertising and fails to uphold the ethical obligation to provide accurate information to patients. Professionals should employ a decision-making framework that prioritizes regulatory compliance and ethical considerations. This involves a thorough review of all marketing materials against relevant federal and state laws, including HIPAA and FTC guidelines. Before launching any campaign, it is advisable to seek legal counsel to ensure all promotional activities are compliant. Furthermore, establishing internal review processes with clear guidelines for content creation and testimonial usage can help mitigate risks. A culture of ethical marketing, where transparency and patient well-being are paramount, should be fostered within the organization. Question 12. Performance analysis shows a significant increase in patient-family disputes regarding the initiation or continuation of life-sustaining treatments for patients with diminished capacity, often stemming from differing interpretations of the patient's values and wishes. As a healthcare administrator, what is the most appropriate risk mitigation strategy to ensure patient-centered care and compliance with regulatory frameworks? Option A. Advise the clinical team to proceed with the most medically aggressive treatment option based on their professional judgment, assuming this aligns with the patient's likely desire to live, and document this decision as a clinical necessity. Option B. Develop a policy that allows for immediate cessation of life-sustaining treatment if the patient's family expresses significant distress or disagreement with the current care plan, without further clinical or ethical review. Option C. Empower the attending physician to make the final decision in consultation with the patient's family, prioritizing the family's perceived understanding of the patient's best interests to minimize prolonged conflict. Option D. Implement a mandatory, structured interdisciplinary meeting protocol involving the patient, if capable, designated healthcare proxy, attending physician, nursing leadership, and an ethics consultant for all cases where there is a significant divergence between patient-family expressed wishes and clinical recommendations regarding life-sustaining treatment. The correct answer is D. Implement a mandatory, structured interdisciplinary meeting protocol involving the patient, if capable, designated healthcare proxy, attending physician, nursing leadership, and an ethics consultant for all cases where there is a significant divergence between patient-family expressed wishes and clinical recommendations regarding life-sustaining treatment. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare management where a patient's expressed preferences for care, particularly regarding end-of-life decisions and the use of life-sustaining technology, may conflict with the clinical team's assessment of medical necessity or the family's interpretation of the patient's best interests. The professional challenge lies in navigating these deeply personal and emotionally charged situations while upholding patient autonomy, ensuring ethical care, and adhering to regulatory requirements for informed consent and patient rights. Balancing the patient's voice with the family's concerns and the clinical team's medical judgment requires careful communication, empathy, and a robust understanding of legal and ethical frameworks. Correct approach analysis. The correct approach involves facilitating a structured, interdisciplinary meeting that prioritizes direct communication with the patient, to the extent of their capacity, and their designated decision-maker, supported by the clinical team and ethics consultation. This approach is grounded in the principles of patient-centered care, which mandate respecting patient autonomy and their right to make informed decisions about their treatment, including the right to refuse life-sustaining treatment. In the U.S. healthcare context, this aligns with the Patient Self-Determination Act, PSDA, which requires healthcare facilities to inform patients of their rights to make decisions about their medical care, including the right to accept or refuse medical or surgical treatment, and the right to formulate advance directives. The involvement of an ethics committee or consultant ensures that complex ethical dilemmas are addressed systematically, promoting a resolution that respects all parties while adhering to legal and ethical standards. This collaborative process aims to achieve shared decision-making, where possible, or to ensure that the patient's wishes, as legally expressed, are honored. Incorrect approaches analysis. One incorrect approach involves deferring solely to the family's wishes without a thorough, documented assessment of the patient's current capacity and prior expressed preferences. This fails to uphold the principle of patient autonomy, which is paramount in healthcare decision-making. Legally, this can violate the patient's rights under the PSDA and state-specific advance directive laws, potentially leading to legal challenges and ethical breaches. Another incorrect approach is to proceed with the family's preferred course of action based on a perceived burden of conflict, without engaging the ethics committee or ensuring a comprehensive understanding of the patient's wishes. This bypasses critical ethical review and can lead to care that is not aligned with the patient's values or best interests, potentially causing significant distress to the patient and their loved ones. It also neglects the regulatory expectation for healthcare providers to have processes in place for resolving ethical conflicts. A third incorrect approach is to unilaterally implement the clinical team's recommendation without adequately exploring the patient's or family's concerns, and ensuring all avenues for communication and understanding have been exhausted. While clinical judgment is vital, patient-centered care requires that this judgment be communicated transparently and discussed collaboratively, respecting the patient's right to understand and question treatment options. This can be perceived as paternalistic and may erode trust, failing to meet the ethical standard of shared decision-making. Professional reasoning. Professionals facing such a scenario should first assess the patient's capacity to make decisions. If the patient has capacity, their wishes are primary, provided they are informed and voluntary. If capacity is diminished, the focus shifts to advance directives and then to the designated healthcare proxy or surrogate decision-maker, following established legal hierarchies. The professional should then initiate a structured communication process involving all relevant parties: patient, family, clinical team, ethics, social work, spiritual care as appropriate. This process should be documented meticulously, including assessments of capacity, discussions held, decisions made, and the rationale behind them. Adherence to institutional policies and relevant state and federal regulations, like the PSDA, is non-negotiable. When conflicts arise that cannot be resolved through direct communication, escalating to an ethics consultation is a critical step in ensuring a fair, ethical, and legally sound resolution. Question 13. Implementation of a new data analytics platform for financial forecasting and operational efficiency in a large hospital system requires a robust risk assessment. Which of the following approaches best addresses the multifaceted risks associated with this implementation? Option A. Prioritizing the immediate deployment of the platform to gain a competitive advantage, with a plan to address any identified risks retrospectively. Option B. Conducting a comprehensive risk assessment that integrates financial, operational, and compliance perspectives, focusing on identifying potential threats to financial stability, data security, and regulatory adherence, and developing mitigation strategies. Option C. Delegating the entire risk assessment process to the IT department, assuming they possess all necessary expertise for financial and operational risks. Option D. Focusing the risk assessment solely on the financial return on investment of the platform, assuming that operational and compliance risks are secondary. The correct answer is B. Conducting a comprehensive risk assessment that integrates financial, operational, and compliance perspectives, focusing on identifying potential threats to financial stability, data security, and regulatory adherence, and developing mitigation strategies. Explanation. This scenario is professionally challenging because it requires a healthcare organization to balance the imperative of financial sustainability with its ethical and regulatory obligations to patient care and data security. The rapid evolution of healthcare technology and the increasing reliance on data analytics for financial forecasting and operational efficiency introduce complex risks that must be proactively managed. Failure to adequately assess and mitigate these risks can lead to significant financial losses, regulatory penalties, reputational damage, and compromised patient outcomes. Careful judgment is required to ensure that financial management strategies align with both strategic goals and compliance requirements. The correct approach involves a comprehensive, multifaceted risk assessment process that integrates financial, operational, and compliance perspectives. This approach prioritizes identifying potential threats to financial stability, such as inaccurate revenue cycle management, unmanaged operational inefficiencies, or noncompliance with payer regulations. It emphasizes the development of robust internal controls, regular audits, and continuous monitoring mechanisms. This aligns with the core principles of sound financial management and the regulatory expectations under frameworks like the Health Insurance Portability and Accountability Act, HIPAA, for data security and privacy, and the Medicare regulations for accurate billing and reimbursement. Proactive identification and mitigation of risks are essential for maintaining financial health and ensuring compliance. An approach that focuses solely on maximizing revenue without a thorough assessment of associated risks is professionally unacceptable. This could lead to aggressive billing practices that violate payer agreements or regulatory guidelines, resulting in audits, recoupments, and penalties. Similarly, an approach that neglects the financial implications of cybersecurity threats or data breaches is also flawed. Such oversights can result in substantial financial liabilities due to fines, legal costs, and the expense of remediation, in addition to severe reputational damage and loss of patient trust, violating HIPAA security and privacy rules. Furthermore, an approach that prioritizes short-term cost-cutting measures without considering their long-term impact on quality of care or operational effectiveness can undermine the organization's mission and lead to greater financial burdens down the line through decreased patient satisfaction and increased readmission rates. Professionals should employ a systematic risk management framework. This involves identifying potential risks, analyzing their likelihood and impact, evaluating existing controls, and developing strategies for mitigation or acceptance. Regular review and updates to the risk assessment process are crucial, especially in the dynamic healthcare environment. Decision-making should be guided by a commitment to ethical practice, regulatory compliance, and the long-term financial health and mission of the organization. Question 14. Which approach would be most compliant with federal regulations and ethical best practices when implementing a health information exchange, HI, for a healthcare organization? Option A. Prioritizing the technical integration and data flow efficiency of the HIE above the verification of patient consent and the requesting entity's authorization for accessing PHI. Option B. Assuming that all patients implicitly consent to data sharing through HIE participation once they receive general notification about the organization's HIE involvement. Option C. Implementing a comprehensive patient consent management system that clearly outlines data sharing purposes and allows for explicit patient authorization or restriction of their protected health information, FAHM, within the HIE. Option D. Adopting a default opt-out mechanism for data sharing, where PHI is shared unless a patient actively submits a request to opt out. The correct answer is C. Implementing a comprehensive patient consent management system that clearly outlines data sharing purposes and allows for explicit patient authorization or restriction of their protected health information, FAHM, within the HIE. Explanation. This scenario presents a professional challenge due to the inherent tension between facilitating efficient healthcare delivery through health information exchange, HI, and the paramount importance of patient privacy and data security, as mandated by U.S. federal regulations, primarily the Health Insurance Portability and Accountability Act, HIPAA. Organizations must navigate complex legal requirements, ethical considerations, and technological capabilities to ensure compliance while maximizing the benefits of HIE. Careful judgment is required to balance these competing interests. The correct approach involves establishing a robust consent management framework that aligns with HIPAA privacy rule and the HITECH Act. This framework must clearly define the scope of patient consent for data sharing, provide patients with understandable information about how their data will be used and disclosed through HIE, and offer mechanisms for patients to grant, revoke, or restrict their consent. This approach is correct because it directly addresses the regulatory requirements for patient privacy and control over their protected health information. 5. By prioritizing informed consent and transparent data sharing practices, it upholds the ethical obligation to respect patient autonomy and minimizes the risk of privacy breaches and associated legal penalties. An incorrect approach would be to assume that participation in an HIE automatically grants permission for all data sharing without explicit patient consent or a clear understanding of the HIE's governance policies. This fails to comply with HIPAA requirements for patient authorization for certain disclosures and the principle of minimum necessary use of PHI. Another incorrect approach would be to implement a blanket opt-out consent model where patient data is shared by default unless actively prohibited. This is problematic as it shifts the burden of privacy protection onto the patient and may not adequately inform patients of their rights or the implications of data sharing, potentially violating the spirit and letter of HIPAA emphasis on patient control. Finally, an approach that prioritizes the technical capabilities of the HIE over patient privacy rights, such as sharing data without verifying the requesting entity's legitimate need or authorization, would be a significant regulatory and ethical failure, exposing the organization to severe penalties and eroding patient trust. Professional reasoning in such situations requires a proactive and compliance-first mindset. Healthcare leaders must first thoroughly understand the applicable regulatory landscape, HIPAA, HITECH, and the specific governance rules of any HIE they participate in. They should then engage legal and compliance experts to develop policies and procedures that ensure patient privacy and data security are integrated into the HIE strategy from the outset. This includes designing clear consent processes, implementing strong data access controls, and conducting regular audits to verify compliance. Prioritizing patient education and transparency is also crucial for fostering trust and ensuring informed decision-making. Question 15. The analysis reveals that state's CHIP program is experiencing a significant churn rate, with a substantial number of children losing coverage and then re-enrolling within a short period. This churn is primarily attributed to families' difficulty in accurately reporting fluctuating monthly incomes, and the program's strict adherence to immediate eligibility adjustments based on reported changes. Which of the following approaches would best address this implementation challenge while adhering to CHIP regulations and promoting continuous coverage for eligible children? Option A. Focus solely on educating families about the importance of timely income reporting and discontinue proactive outreach efforts to conserve resources. Option B. Increase the frequency of eligibility reviews and require families to submit detailed pay stubs for every month of the benefit period to ensure strict compliance with income limits. Option C. Implement a grace period for income reporting and explore options for using average income over a defined period for eligibility determination, alongside enhanced automated data matching with other state and federal benefit programs to verify eligibility. Option D. Reduce the duration of CHIP coverage periods and require a full reapplication process for all beneficiaries annually, regardless of income stability. The correct answer is C. Implement a grace period for income reporting and explore options for using average income over a defined period for eligibility determination, alongside enhanced automated data matching with other state and federal benefit programs to verify eligibility. Explanation. The analysis reveals a common implementation challenge for state-level CHIP programs, ensuring continuous enrollment for eligible children amidst fluctuating family incomes and administrative hurdles. This scenario is professionally challenging because it requires balancing program integrity with the fundamental goal of providing healthcare access to vulnerable populations. Missteps can lead to eligible children losing coverage, creating significant health and financial burdens for families and potentially increasing uncompensated care costs for providers. Careful judgment is required to navigate complex eligibility rules, streamline administrative processes, and maintain robust outreach efforts. The correct approach involves proactive strategies to mitigate coverage gaps. This includes implementing robust grace periods for reporting income changes, utilizing automated data matching with other federal and state programs to verify eligibility without requiring excessive documentation from families, and establishing clear, accessible communication channels for beneficiaries to report changes. This approach aligns with the spirit and intent of CHIP, which is to provide a safety net for children's health insurance. Regulatory frameworks governing CHIP, such as those established by the Centers for Medicare and Medicaid Services, CMS, under the Social Security Act, emphasize minimizing administrative burdens on families and ensuring continuous coverage for eligible individuals. Ethical considerations also strongly support this approach, prioritizing the well-being of children and their access to necessary medical care. An incorrect approach would be to strictly enforce immediate termination of coverage upon any reported income fluctuation exceeding the CHIP threshold, without considering a reasonable transition period or alternative eligibility pathways. This fails to acknowledge the realities of low-income households, where income can be variable and reporting changes may be delayed due to practical constraints. Such a rigid approach could lead to eligible children losing coverage unnecessarily, violating the program's purpose and potentially contravening CMS guidance on continuous coverage. Another incorrect approach would be to rely solely on periodic paper-based recertification processes that require families to resubmit extensive documentation, even for minor income changes. This creates significant administrative burdens for families, particularly those with limited literacy or access to technology, and increases the likelihood of missed deadlines and subsequent coverage loss. This method is inefficient and can inadvertently disenfranchise eligible children, failing to meet the program's accessibility goals and potentially conflicting with efforts to streamline enrollment processes. A third incorrect approach would be to reduce outreach and enrollment assistance efforts due to budget constraints, assuming that families will proactively manage their eligibility. This neglects the critical role of outreach in informing families about CHIP, assisting them with applications, and helping them navigate the recertification process. Without adequate outreach, many eligible children may never enroll or may lose coverage due to a lack of awareness or support, undermining the program's effectiveness and failing to serve its intended beneficiaries. A professional reasoning process for similar situations should involve a thorough understanding of CHIP legislative intent and regulatory requirements, a commitment to patient-centered care, and a proactive approach to identifying and mitigating potential barriers to enrollment and continuous coverage. This includes regularly reviewing program policies and procedures for efficiency and accessibility, engaging with beneficiary communities to understand their challenges, and leveraging technology and interagency collaboration to streamline administrative processes. Question 16. The risk matrix shows a significant projected increase in uncompensated care costs due to anticipated changes in payer reimbursement rates and a rise in the uninsured patient population. The Finance Department proposes immediate implementation of stricter pre-authorization requirements for all elective procedures and a reduction in the availability of certain high-cost diagnostic imaging services, citing the need to protect the organization's financial stability. Option A. Negotiate new contracts with all major payers to secure higher reimbursement rates, even if it means reducing the scope of services offered to patients. Option B. Focus solely on increasing revenue through aggressive billing and collection practices without altering service availability or pre-authorization protocols. Option C. Immediately implement the proposed stricter pre-authorization requirements for all elective procedures and reduce the availability of high-cost diagnostic imaging services to curb uncompensated care costs. Option D. Develop a comprehensive financial sustainability plan that includes a phased approach to cost containment, enhanced patient financial counseling services to maximize eligible coverage and payment plans, and a review of service line profitability to identify areas for efficiency improvements, while ensuring no disruption to medically necessary care. The correct answer is D. Develop a comprehensive financial sustainability plan that includes a phased approach to cost containment, enhanced patient financial counseling services to maximize eligible coverage and payment plans, and a review of service line profitability to identify areas for efficiency improvements, while ensuring no disruption to medically necessary care. Explanation. This scenario presents a common implementation challenge in healthcare finance, balancing the need for robust financial controls with the imperative to maintain patient access to care, all within the complex regulatory landscape of the U.S. healthcare system. The challenge lies in the inherent tension between cost containment measures and the ethical obligation to provide necessary medical services. Professionals must navigate these competing priorities while adhering to federal and state laws, including those governing Medicare, Medicaid, and private payer contracts, as well as internal organizational policies. The correct approach involves a multifaceted strategy that prioritizes transparent communication, data-driven decision-making, and collaborative problem-solving. This includes engaging all relevant stakeholders, such as clinical staff, finance departments, and compliance officers, to develop a comprehensive understanding of the financial implications and potential impacts on patient care. Implementing phased changes with clear performance metrics and regular review cycles allows for adaptive management and ensures that financial goals do not compromise patient well-being or violate regulatory requirements. This approach aligns with the ethical principles of beneficence and non-maleficence, as well as the regulatory duty to provide care in accordance with established standards and payer agreements. An incorrect approach would be to unilaterally implement significant cost-saving measures without adequate consultation or consideration of patient impact. For instance, abruptly restricting access to certain high-cost treatments or imposing stringent pre-authorization requirements without a clear clinical rationale or established appeals process could violate patient rights and potentially contravene the Emergency Medical Treatment and Labor Act, EMTALA, if it leads to denial of necessary emergency care. Another flawed approach would be to focus solely on financial metrics without considering the long-term implications for patient outcomes and organizational reputation, potentially leading to a decline in quality of care and increased downstream costs. Furthermore, failing to document the rationale for financial decisions or to ensure compliance with all applicable billing and coding regulations could result in audits, penalties, and reputational damage. Professionals should employ a decision-making framework that begins with a thorough assessment of the problem, considering both financial and clinical perspectives. This involves gathering data, consulting with experts, and evaluating potential solutions against regulatory requirements, ethical considerations, and organizational mission. A collaborative approach, involving diverse stakeholders, fosters buy-in and leads to more sustainable and effective solutions. Regular monitoring and evaluation are crucial to adapt strategies as needed and ensure ongoing compliance and optimal patient care. Question 17. Governance review demonstrates that while the organization's overall patient satisfaction scores have seen a modest increase, the Consumer Assessment of Healthcare Providers and Systems (COPS) survey results indicate persistent areas of concern regarding communication during and after hospital stays. To address these specific COPS findings and optimize the patient experience, which of the following approaches would be most aligned with regulatory expectations and ethical best practices for improving survey outcomes? Option A. Establish a bonus structure for clinical departments directly tied to their aggregate COPS scores, encouraging staff to prioritize patient satisfaction metrics. Option B. Provide patients with a guide on how to best answer COPS survey questions, highlighting aspects of care that are typically scored favorably. Option C. Implement a comprehensive staff training program focused on empathetic communication, active listening, and clear explanation of medical information, alongside standardizing discharge instructions to ensure consistency and patient comprehension. Option D. Develop a protocol to identify patients who are likely to provide negative feedback and exclude them from the COPS survey sample to improve the overall score. The correct answer is C. Implement a comprehensive staff training program focused on empathetic communication, active listening, and clear explanation of medical information, alongside standardizing discharge instructions to ensure consistency and patient comprehension. Explanation. This scenario presents a professional challenge because it requires balancing the imperative to improve patient experience, as measured by COPS surveys, with the ethical and regulatory obligation to ensure data integrity and avoid any perception of manipulation. Healthcare organizations are under increasing pressure to demonstrate quality and patient satisfaction, making COPS scores a critical performance indicator. However, the methods used to improve these scores must be compliant with regulations and ethical standards, particularly those governing patient surveys and data reporting. The challenge lies in identifying and implementing process improvements that genuinely enhance patient care and communication, without resorting to practices that could compromise the validity of the survey results or violate patient privacy. The correct approach involves a systematic, data-driven review of patient feedback and operational processes to identify root causes of dissatisfaction and implement targeted, evidence-based interventions. This approach aligns with the principles of continuous quality improvement and is consistent with the spirit of COPS, which aims to provide actionable insights for improving care. Specifically, focusing on staff training and communication skills, standardizing discharge instructions, and improving patient flow directly addresses common areas of patient concern identified in COPS surveys. These improvements are designed to enhance the patient experience organically, leading to more authentic and positive survey responses. Regulatory frameworks, such as those overseen by CMS, Centers for Medicare and Medicaid Services, for programs like the Hospital Value-Based Purchasing Program, emphasize the importance of patient experience metrics derived from valid and reliable surveys. Ethical considerations also mandate that organizations strive for genuine improvement rather than superficial gains. An incorrect approach that involves directly instructing patients on how to answer survey questions is ethically and regulatorily unsound. This constitutes survey manipulation, which undermines the validity of COPS data and violates the trust placed in healthcare providers. Such actions could lead to sanctions from regulatory bodies and damage the organization's reputation. Furthermore, it fails to address the underlying issues that may be causing patient dissatisfaction. Another incorrect approach, focusing solely on incentivizing staff based on aggregate COPS scores without addressing the root causes of patient feedback, is problematic. While staff engagement is important, this method can inadvertently encourage staff to focus on survey responses rather than on delivering high-quality care. It risks creating a culture where the appearance of satisfaction is prioritized over actual patient well-being and can lead to biased reporting or pressure on patients. This approach does not align with the goal of genuine process optimization and can be seen as a form of data gaming, which is contrary to regulatory intent. A third incorrect approach, which involves selectively excluding patients from surveys based on perceived likelihood of negative feedback, is a clear violation of survey methodology and ethical principles. COP surveys are designed to capture a representative sample of patient experiences. Excluding certain patients compromises the statistical validity of the data and is a form of data manipulation. This practice is not only unethical, but also likely to be in direct violation of CMS guidelines for survey administration. The professional decision-making process for similar situations should involve a commitment to transparency, data integrity, and genuine patient-centered care. Healthcare leaders must prioritize understanding the underlying reasons for patient feedback, both positive and negative, and use this information to drive meaningful improvements in clinical processes, communication, and patient engagement. This requires a culture that values continuous learning and ethical conduct, supported by robust governance structures that ensure compliance with all relevant regulations and guidelines. Question 18. Quality control measures reveal that during a recent hospital-wide system outage, a physician accessed a patient's complete medical record, including historical diagnostic images and detailed billing information, to address an immediate critical care need. The physician documented that the access was necessary for patient treatment. However, the access logs show that information beyond what was strictly required for the immediate treatment decision was also reviewed. Which of the following approaches best aligns with HIPAA requirements for data security and privacy in this scenario? Option A. The physician should have only accessed the minimum necessary information directly related to the immediate critical care need, and the review of historical diagnostic images and billing information, even if documented as necessary, constitutes a potential HIPAA violation due to overaccess. Option B. The physician should have sought verbal authorization from the patient's next of kin before accessing any part of the medical record, even in a critical care situation. Option C. The physician's access was justified for treatment purposes, and the review of additional information, while not ideal, is acceptable given the emergency nature of the system outage and the critical care situation. Option D. The physician's access was permissible because the system outage created an emergency situation that temporarily suspends standard HIPAA privacy requirements for patient care. The correct answer is C. The physician's access was justified for treatment purposes, and the review of additional information, while not ideal, is acceptable given the emergency nature of the system outage and the critical care situation. Explanation. This scenario is professionally challenging because it requires balancing the immediate need for data access to address a critical patient care issue with the stringent requirements of HIPAA privacy rule. Healthcare organizations must have robust policies and procedures in place to ensure that protected health information, FAHM, is accessed and used only for permissible purposes and to the minimum extent necessary. The urgency of the situation does not override these fundamental legal and ethical obligations. The correct approach involves a careful assessment of the situation against HIPAA provisions for access to PHI in emergency circumstances. Specifically, it requires determining if the access is for treatment, payment, or healthcare operations, and if it is limited to the minimum necessary information. This approach upholds patient privacy while ensuring continuity of care, aligning with both the letter and spirit of HIPAA. An incorrect approach that involves accessing all available patient data without a specific, documented justification for each piece of information violates the minimum necessary standard under HIPAA. This broad access, even with good intentions, creates an unnecessary risk of privacy breaches and can lead to significant penalties. Another incorrect approach that involves delaying access to critical patient data due to an overly cautious interpretation of HIPAA, thereby jeopardizing patient safety, fails to recognize the exceptions and allowances within HIPAA for emergency situations. While privacy is paramount, patient well-being is also a core ethical and legal consideration. A further incorrect approach that involves relying solely on verbal authorization from a non-authorized individual to access PHI is insufficient under HIPAA. While patient authorization is a key component of privacy, the rules specify who can provide authorization and under what circumstances. An emergency access often has specific protocols that do not rely on informal verbal consent from individuals who may not have the legal authority to grant it. The professional decision-making process for similar situations should involve a clear understanding of HIPAA core principles, including the minimum necessary standard and permissible uses and disclosures. When faced with urgent situations, healthcare professionals should consult established organizational policies and procedures for emergency access to PHI. If ambiguity exists, seeking guidance from the organization's privacy officer or legal counsel is crucial to ensure compliance and protect both patient privacy and the organization. Question 19. Process analysis reveals that a leading biotechnology firm has introduced a novel gene therapy with promising early-stage clinical trial data for a rare genetic disorder. The therapy is associated with a significantly high acquisition cost. The healthcare organization's leadership is considering its inclusion on the formulary. Which of the following approaches best aligns with best practices for evaluating and integrating such a high-cost, innovative pharmaceutical within the U.S. regulatory framework? Option A. Conduct a comprehensive, multidisciplinary evaluation including a thorough review of FDA approval status, real-world evidence, comparative effectiveness, pharmacoeconomic analyses, and alignment with organizational financial stewardship principles, while engaging key stakeholders and adhering to established P&T committee protocols. Option B. Rely primarily on the marketing materials and physician testimonials provided by the biotechnology firm to assess the therapy's value, and proceed with formulary inclusion if a significant number of physicians express strong interest in prescribing it. Option C. Expedite the formulary review process by bypassing the standard P&T committee review and seeking direct approval from the chief medical officer, focusing solely on the potential for positive media coverage and enhanced organizational reputation. Option D. Prioritize the inclusion of the gene therapy based on its innovative nature and potential to address an unmet medical need, initiating a rapid formulary review process to ensure timely patient access, and deferring detailed pharmacoeconomic analysis until after initial adoption. Correct answer is D. Prioritize the inclusion of the gene therapy based on its innovative nature and potential to address an unmet medical need, initiating a rapid formulary review process to ensure timely patient access, and deferring detailed pharmacoeconomic analysis until after initial adoption. Explanation. This scenario presents a professional challenge due to the complex interplay between pharmaceutical innovation, patient access, and regulatory oversight within the U.S. healthcare system. Healthcare executives must balance the imperative to adopt potentially life-saving or life-improving therapies with the fiduciary responsibility to manage organizational resources prudently and ensure compliance with federal and state laws governing drug procurement, reimbursement, and patient safety. The rapid pace of biotechnology advancements, coupled with the high cost of novel treatments, necessitates a rigorous evaluation process that goes beyond mere clinical efficacy to encompass economic viability, ethical considerations, and adherence to established healthcare regulations. The correct approach involves a comprehensive, multidisciplinary evaluation that prioritizes evidence-based decision-making, patient benefit, and regulatory compliance. This includes a thorough review of clinical trial data, real-world evidence, comparative effectiveness studies, and pharmacoeconomic analyses. Furthermore, it necessitates engagement with relevant stakeholders, including clinicians, pharmacists, patient advocacy groups, and payers, to understand the broader implications of adopting a new pharmaceutical. Adherence to guidelines from bodies like the FDA for drug approval and CMS for reimbursement, as well as state-specific pharmacy and therapeutics committee protocols, is paramount. This approach ensures that decisions are grounded in scientific merit, patient needs, and legal frameworks, fostering trust and accountability within the healthcare organization. An incorrect approach would be to prioritize solely the perceived prestige or novelty of a biotechnology product without a robust evaluation of its clinical utility, safety profile, and cost-effectiveness. This could lead to the adoption of expensive treatments that offer marginal benefits over existing therapies, straining organizational budgets and potentially diverting resources from more impactful interventions. Another incorrect approach is to bypass established internal review processes, such as pharmacy and therapeutics committee recommendations, in favor of physician preference or marketing influence. This undermines the integrity of the decision-making process and can lead to suboptimal formulary management and potential patient harm. Failing to consider the nuances of reimbursement pathways, including Medicare Part D and Medicaid, or state-specific prior authorization requirements, also represents a significant regulatory and operational failure, potentially leading to denied claims and financial losses. Professional decision-making in such situations requires a structured, evidence-based framework. This involves establishing clear criteria for evaluating new pharmaceuticals, ensuring transparency in the review process, and fostering collaboration among all relevant departments. A commitment to continuous learning and staying abreast of evolving regulatory landscapes and scientific advancements is also crucial. When faced with novel biotechnology products, healthcare leaders should ask, does this product offer a demonstrable improvement in patient outcomes compared to existing treatments? Is the cost justified by the clinical benefit? Does its adoption align with our organization's mission and financial sustainability? Are all regulatory requirements for procurement, administration, and reimbursement being met? Question 20. Consider a scenario where a large hospital system is tasked with implementing provisions of the Affordable Care Act, ACA, aimed at expanding insurance coverage and improving the quality of care for its patient population. The system faces significant operational challenges, including integrating new insurance marketplace plans, adapting electronic health record systems to meet reporting requirements, and reevaluating care coordination protocols to reduce readmissions. Which of the following approaches best addresses these implementation challenges while adhering to ACA mandates and ethical healthcare principles? Option A. Focus primarily on reducing operational costs associated with ACA implementation by streamlining administrative processes and deferring investments in patient-facing technology and staff development. Option B. Mandate immediate adoption of all ACA-related changes across all departments without adequate preparation or communication, expecting staff to adapt quickly to new workflows and patient eligibility criteria. Option C. Implement a comprehensive, phased approach that prioritizes patient access to ACA-compliant insurance plans, invests in staff training for new reporting requirements, and establishes robust care coordination programs with clear performance metrics. Option D. Delay the integration of new insurance marketplace plans and postpone significant upgrades to electronic health record systems until the organization has a clearer understanding of long-term ACA impacts. The correct answer is C. Implement a comprehensive, phased approach that prioritizes patient access to ACA-compliant insurance plans, invests in staff training for new reporting requirements, and establishes robust care coordination programs with clear performance metrics. Explanation. This scenario presents a significant implementation challenge for a healthcare organization navigating the complexities of the Affordable Care Act, ACA. The core difficulty lies in balancing the mandate to expand coverage and improve quality with the practical realities of resource allocation, operational integration, and stakeholder buy-in. Professionals must exercise careful judgment to ensure compliance while maintaining financial sustainability and patient access. The correct approach involves a phased, data-driven implementation strategy that prioritizes patient access and quality improvement initiatives aligned with ACA provisions. This includes robust stakeholder engagement, clear communication of changes, and ongoing monitoring of key performance indicators. Regulatory justification stems from the ACA's core objectives of increasing insurance coverage, improving health outcomes, and controlling healthcare costs. Ethical considerations demand that the organization act in the best interest of its patients, ensuring they can access necessary care and benefit from quality enhancements without undue financial burden or disruption. An incorrect approach would be to solely focus on cost-cutting measures without a corresponding strategy for maintaining or improving patient access and quality of care. This fails to uphold the spirit and letter of the ACA, which aims to expand access and improve outcomes, not simply reduce expenditures at the expense of patient well-being. Such an approach risks violating regulatory requirements related to coverage mandates and quality reporting. Another incorrect approach would be to implement changes without adequate staff training or patient education. This creates confusion, reduces efficiency, and can lead to errors in care delivery or billing, potentially resulting in non-compliance with ACA reporting requirements and negatively impacting patient experience and trust. Ethically, it demonstrates a lack of due diligence in preparing the organization and its beneficiaries for significant operational shifts. A third incorrect approach would be to delay or resist the implementation of ACA-mandated changes due to perceived operational burdens. This not only risks regulatory penalties, but also fails to capitalize on opportunities to improve patient care and potentially access new revenue streams or incentives offered under the ACA. It represents a failure to adapt to evolving healthcare policy and a disregard for the intended benefits of the legislation. Professionals should employ a decision-making framework that begins with a thorough understanding of the ACA's requirements and their implications for the organization. This involves assessing current operational capacity, identifying potential gaps, and developing a strategic plan that aligns with both regulatory mandates and organizational goals. Continuous stakeholder engagement, data analysis, and a commitment to patient-centered care are crucial for successful and compliant implementation.